We're good. We're just trying to get who's available.
Sorry?
And this is?
I can put it up here.
Yes. Mm-hmm.
Um, yeah. Good. Good. Can you hear me, Mr. Chairman?
Yeah, you're good.
Okay.
You can hear me, I hope.
We're ready to open.
Who's on board here? I see Eric's here.
Todd? We're getting an echo.
Bruce?
Yes, go ahead. Can you hear me?
Yeah, you're very clear.
We're ready to call the meeting and proceed.
Okay, sounds good. Well, good evening. Welcome to the January 24th, 2022 meeting of the Yarmouth Board of Health. Please note this is a remote participation meeting. I just have one short blurb here to read, and that is specific information such as instructions and guidelines for remote by members of the public and or parties with the right and or requirement to attend this meeting can be found on the town website, which is www.yarmouth.ma.us. Before we get started, we certainly need to take attendance. Mary, are you present? Apparently not. Okay. Eric, are you here?
Here.
Okay. And Charlie, present?
Yes.
Yeah.
Charlie, that's a yes. Okay. I'm Millard Bosky. That's 3 members. Deborah will not be joining us tonight. I know that. Director Murphy, you're here.
Mary is available. She's just signing in right now.
Fine.
Can you hear us, Mary, and say anything?
She's a,
Yeah, I've been here, but I wasn't joined as a panelist, so I just did that. Sorry.
Okay, no, we just joined you in, okay?
don't feel rejected. We do want you. Okay, attendance is done. Let's go on. Public comment is next up as usual, and this will be time for anyone to address the board. And I think what we'll do is, if anyone would like to speak about a non-COVID subject, we could do that now, and then further down looking the agenda, we have some COVID issues, and perhaps at that point the public gets another chance to certainly come forward and speak up. So Director Murphy, do we have anyone who'd like to speak at this point?
Do we have, no, do we have one person with a hand up? Yes, we have one person. Let me check how we can put that person in.
Great.
Okay, Matt Pitter. You've been omitted, Matt. Do you have anything you wish to say?
Yes, thank you. Thank you. Appreciate that. Based on what the chair just said, perhaps our comments should hold. We just wanted to provide some comments based on the Davenport companies here in Yarmouth on the item on the agenda regarding COVID. So should we hold on those comments for now? And will we have a chance to make some comments at that time?
You know, as I said, why don't we postpone that a little bit? Hopefully you'll stay with us and be able to speak up at that point. That's all.
Great, that's fine. We'll stay on the call and wait for you to get to that item on the agenda.
Absolutely. Everyone needs an opportunity to come forward. That's for sure.
Thank you.
Director Murphy, anyone else there?
No, we can proceed to the agenda.
Great. Second item on the agenda is a hearing, and this is a retail tobacco violation. Now this one's located at 50 Long Pond Drive convenience store in South Yarmouth. Bruce, is this one we're going to hear tonight or not?
This one, we're going to move to our February, next meeting, February 7th. The person was not available, was not feeling well tonight.
Yeah, that's what I thought. Okay. So let's skip that and go on to the next hearing. There are actually 3 of them tonight.
Yeah.
And this is a retail tobacco violation. And location was 182-D Old Town House Road, convenience store, South Yarmouth. And it's listed here as a sale of flavored tobacco, and it's a first offense. So Director Murphy, can you just tell us a little bit about this?
Yeah. What we have was a inspection conducted by the county health tobacco control program that works with the health department. And on December 15th in the morning, they conducted a compliance check. And at that time, they found black and mild cream cigars, which is a violation of the flavored tobacco in Yarmouth, but it is also now a state violation for the past couple years. So, so a fine, as it's his first offense, we have not had any past violations. He has passed previous inspections. So this is a new inspection right here. So the owner, Bhadesh Patel, is available. He'll go over what the inspection was and what was found. You have the inspection report there. It's probably hard for people to see at home, but you have it in your packet, which basically gives you the date of the inspection. It was completed by Bob Collette, who's the director of the Barnstable County Tobacco Control Program. And the violation was noted down the bottom as a flavored product. And I think what we're going to have, I'll let Mr. Patel mention what the discrepancy was, and then we'll have another slide for you. So with that, you want to just mention what was found?
Hi, my name is Bhadesh Patel, and I'm owner of the Townhouse News. And we received delivery in December 1st, 2021. And I don't know, we check all the 8-page delivery coming, and this is original copy. And we check the 6-page, but 2-page we forgot to check it out. You know, the deliveries, all of them. And I don't know how we missing this one stuff, and all tobacco. This is 2 box coming. One is a regular and one is a cream. And we don't know usually we have 2-3 years. We never got the delivery in coming any flavor. But this company, they deliver in Rhode Island, Massachusetts, Maine, and Connecticut too. That's why I don't know how we got by mistake we received, and my people, they just put it in self. And whatever, we just, I think 15 days, we sold the 3 package already. But whatever 7-package I bring here, you know.
So we have it up on the screen here. You can see you order not through a salesman that's comes to you. You order online, and I think what you're showing is you ordered a product online, but that was not the product that was delivered.
No,
Is that correct?
that's the wrong product delivery. They deliver the wrong product. Whatever we ordered the regular, but I got the 1 box regular and one is the cream come out.
So they shipped you a box that you had not requested,
Yes.
but they know it's a flavor. They can't ship them anywhere in
Anywhere in
Massachusetts.
Massachusetts, they're not supposed to.
You contacted them?
Yeah, I talked to them and they say, sorry, but what can I do?
Well, obviously there's a fine
They-
associated with it.
They have a shortage in help too, you know.
Does your store manager check the shipment when it comes in to check off to make sure it matches up with what you have and then notice the discrepancy?
Yeah, but whatever the date, we have an 8-page delivery coming, right? And we checked 6 page already, but 2 pages we didn't check. I don't know why, but that's why we have a problem. This is what is now copied.
So he checked 6 of the 8 pages?
Yeah, 8 pages, yeah.
Well, that was also part of the problem too then.
Yeah, that's why that's why it happened. You know, they didn't check the whole thing, whole product. That's
And
why.
I know you can't be at you own a couple stores, so you can't be at each one when a tobacco shipment arrives, but your store managers are trained to go over that. I mean, you must have already discussed this discrepancy with them.
I told them, but they, you know, I can't post too much right now. You know, the health problem everywhere right
Mhm,
now.
mhm.
People, they don't want to work right now, you know.
Okay. Mr. Chairman, questions from the board?
Yeah. Members?
How long has your manager there been in place?
She's in 10 years right now.
10 years. So he or she is well aware of the prohibition against flavored tobaccos.
Yeah.
I'd like to clear something up here with me. The fine for this tobacco enforcement, I thought originally was for violation if you were selling it.
You
Correct.
did sell it.
Can't
Did
be
sell it.
correct because he didn't sell it. That's what I'm
He
trying to
did.
understand here.
It was on the shelf for sale.
So it's a violation if it's in his possession, period, then.
Well,
It's not-
he
not
said he sold some. He said he sold some before he realized it.
Did you sell some?
Yeah, if I know, I don't want to sell anyway, but you know, the guy, whoever.
Did
they
you,
put it in-
did you sell some of that?
Yeah, 3
Oh,
pieces,
okay, no,
3
because
pieces.
I just want to get myself clear on some of this stuff because, you know, if it's a violation, if it's in his possession and he didn't sell it, I don't understand that.
But he did sell it.
But in this one, he did sell to the person going to do the compliance
Okay,
check.
all right.
3 pieces.
I consider it a violation, but if it was somewhere in the store and he didn't sell it, I don't consider that a violation.
But
Yeah,
the
the
issue,
question, it's a good point to make, but Bruce, if a product is on the shelf for sale, a flavored tobacco, I mean, a person would still, it would count as an offense, the way it's been written or the way it's been looked at. It's regardless of whether it's actually
Right.
been sold,
Correct.
unless I'm mistaken.
Right. That's how it's been. Yes.
Yes. So it's not the issue if it was sold or not, but if it's in place for sale in the store, that's why people have gotten offenses.
Some of them. Yeah.
Correct.
Okay.
Badesh, have you talked to them about making sure they're not bringing in any other flavored tobacco products that they're supposed to be not spelling in Massachusetts anyway? What's the procedure they're putting in?
I talked to the owner of the J. Pollock company, the main manager in the Cape Cod, and he said he checked it out, the whole thing, you know, but, and now I just check it out myself too, you know. I don't want to trouble again, you know.
Yeah, I mean, this is not new. I mean, this regulation's been there for a long time. I mean, if it was my store, I would make sure distributor paid for the fine. I mean, it
Right.
sounds like they're the first place to find fault and not the store. But certainly, yes, the manager needs to be more careful looking at what's coming in before things go on a shelf. Eric, it looked like you were going to make a comment.
I was just going to clarify what you had said, that the product doesn't necessarily need to be sold, but if it's out on display for sale, that's a violation. That was all.
Okay. So it appears it is. So Director Murphy, what's our responsibility as usual?
It's a violation of the Board of Health tobacco regulation, so there is a fine associated with that. Unless you felt there was extraordinary circumstances on the issue.
Does anyone feel that way?
No, I don't. I think with a manager in place for 10 years, that shouldn't have happened.
I agree. So, we need to vote on this or not?
Yes, a vote by the board.
Someone make a motion there, and we can obviously move on here.
I move that we hold the violation for 182D Old Townhouse Road Convenience Store for a first offense, a fine of $300.
Mary, thank you. Is there a second to that?
Second.
Thank you. Also, any other discussion about it? Apparently not. So all in favor, just raise your hand and say aye. Aye.
Aye.
Charlie
Nay.
is a nay. So it's 3-1. Okay. So issued fine, and we can move on.
I will make a note that the fine has been submitted, payment.
Thank you.
Okay, Bruce, thanks.
Thank you.
Thank you.
Okay, something's already happened where we've gotten 3 tobacco violations here.
All right.
So maybe I think something's falling apart, but this is a hearing again here, retail tobacco violation. Location is 447 Route 28, convenience store in West Yarmouth. This is a little different. This is an FDA violation, and Director Murphy, maybe explain that for the public of what that means.
Yes, besides the health department staff doing compliance checks, Barnstable County Tobacco Compliance does compliance checks, and then the federal FDA comes around and does their own spot checks. They don't go through all the establishments. They select the ones they wish to inspect. In this case, they did find a violation, an age violation sale at the convenience store. And because it's not one of our inspectors, we cannot use that violation to issue a fine. Our fines can only be associated with Board of Health inspectors or county inspectors. But what we've done in the past is ask the store manager to come in to say what steps they're going to take to ensure that violations won't happen in the future, and what steps they've discussed with their employees. This FDA violation, their first violation was just a warning. So we do have a store manager here that's ready to explain to the board what positive steps they're taking to ensure no further violations.
Okay, thank you. Just introduce yourself for the record. Thank you.
You're on.
Hi, I'm Gail Ricard, and I'm the manager of the Dollar General.
Thank you for coming in. So, why don't you tell us a little bit about the store and what took place?
Sure. It's, well, I have been the manager for only 2 weeks. This violation was a few months ago. So what I have done, apparently after that violation happened, according to the district manager, the cash registers have been changed. So we now scan the license and then we input in the birth date. When I came in, there was a total change of employees, which we're now putting in place. So everyone is new. So I am talking, I've been in retail before, so I am talking to everybody about the importance of it. I have put a little thing right on the registers that the employees can see, as well as the customers, saying if you were born after this date in 2020, so everybody's clear and they're not confused when they look at the license. So we have talked about that. And I believe with this new system in the cash register, if a date is inputted that is not the correct date, it won't let it continue. So we're locked out of doing anything further.
Oh, that's very good. So you have the new scan system. That's terrific. That wasn't standard in all their stores?
Apparently not. Apparently, when this happened in November, they did not have that.
Okay, so that was something they brought into the store. That's good. So
Mhm.
that's good. Now, does the employee also ask the person if what's their age date is?
What they do is, as soon as you scan in cigarettes, it blocks you and you have to scan the license. If they won't let you scan the license, you have to input it in by hand. And then it'll go right from there. It'll go to what is the date of birth. So
Okay,
you can't go on until that happens.
okay. And then how often do you talk to various store managers or employees the importance of this?
Right now, I'm just hiring everybody. Everybody's coming in for the first time, and that is part of their talk when they come in. We have it locked, so I show them the keys. I show them that the case is always locked. We go over all of that.
Okay.
Mhm.
Is this something that you review with the staff and employees monthly, quarterly?
I will. I haven't been there a month yet,
Okay,
but,
yes.
but yes, I definitely will. We'll take that very seriously.
Okay,
Yeah,
okay.
yeah.
Obviously, you can see the Board of Health and the Health Department takes it very seriously also. And the town's usually been very, very good on our tobacco compliance over the years.
Yeah, and when I spoke with the health department when they came in, they also said there are some training videos that I'm going to incorporate into the regular Dollar General training
Okay.
videos for them to watch as well.
Good, okay. Mr. Chairman?
Yeah, no, I appreciate you coming in. It sounds like you have things under control. It's nice to hear that. You sound very organized and it's impressive. And hopefully, don't be offended by this. Hopefully, we don't see you again for this reason. That's all. But welcome to the business community. It's great. Any board members, comments, anything?
I just wondered, I don't remember seeing Dollar General on our list of tobacco retailers. Is it?
Yes, it is.
It is, okay. I didn't look up an old list.
It's probably just down by address, but yes, it is.
Okay, gotcha. Okay.
Any other questions? Charlie, Eric, anyone?
No.
Okay.
Good luck with your job.
Thank you.
Thank you.
Look.
Thank you for coming in.
Okay, the fifth item tonight. It's a discussion and it's Barnstable County American Rescue Plan Act funding, which includes a vote. This may need some explanations a little bit, Bruce, just exactly what the Cape and Islands Health Agents Coalition is, maybe definition, just what the Barnstable County Commissioners are. It gets a little complicated just looking at the paperwork, and certainly the public who's watching would want to get a full grasp of it. So just to get the essence of it, maybe you could speak a little bit about it, Bruce. Thank you.
Yes, we have the Federal American Resource Plan Act, which APR, money provided to the Barnstable County Health Department in the amount of 41 million. It is now up to, it has been up to the county commissioners and assembly of delegates to determine how that 41 million would be used on the Cape and with the Cape towns. So they've looked at, a first draft through the county. They're looking at putting money towards wastewater, water issues. I think that's the couple of the big areas. They're looking at high speed, cable. But I think what we wanted to concentrate on was money going towards public health and staying within the county department. And they do mention some will be going towards health services. Obviously, we'd like to see some as soon as we can towards public health systems for vaccination clinics and expanding the vaccination clinics throughout the Cape, even though we have some now that have picked up, but I think we could have more vaccination clinics as we look at vaccination rates across the towns. I think that's helpful along with testing sites. So what the county health directors that get together once a month developed a letter of position from all the directors of health stating that they would like to have a priority towards for consideration of public health systems. Part of the public health systems, including testing of ponds for cyanobacteria, which we noticed this year that was picked up in Long Pond, and we had to close the 3 beaches towards the end of the season. So money would be needed to assist the county laboratory for possibly staffing and testing availability for the cyanobacteria, and that's across the whole Cape. So I think that's important. You have the county letter there. Again, we obviously we're supporting wastewater, water quality, drinking water quality issues, and just wanted to stress the need for the public health systems. So I'm looking to the board of support from the board, from the letter that went out from all the directors of health, and if there's anything else that the board may wish to consider.
Bruce, the article says that water, sewer, broadband are the priorities, and then the next priority amongst the whole group of the next priorities is public health systems. So you're saying that the group endorsed the water sewage type efforts, but public health systems, you're looking at separately issues like the water testing and the vaccination clinics. Am I correct?
You are correct, and I think they recognize the need for public health systems. I think it's going to come down to when they're dividing the 41 million up, how much is going into various areas, and obviously the health directors feel that public health systems need to be given some serious thoughts so we can get the vaccination clinics going too. They don't say what how the pot's being divvied up yet, but I think that sufficient should also go towards public health systems.
Apart from the water and sewer, because they're giving that the highest priority.
Yes, they should get the highest priorities.
Right. Yeah, I mean, I think it's been made pretty clear with this pandemic that our public health system in this country is woefully underfunded and not as robust as it should be.
So am I to understand that you want to spend $41 million on testing and vaccinations?
No, just a portion of it. A majority will be going towards town's wastewater planning, wastewater construction.
I'd like to see
Drinking
some of
water.
it go to use instead of just testing. That's
Right,
what I'm talking
right.
about.
We'd rather have it go towards vaccination and.
I'd
right.
rather have it go to something that's going to work.
So what would you like from us, Bruce? You would like our endorsement of the letter that we were sent a
Yes,
copy of?
I think that would be helpful, that I could forward to the commissioners and the assembly of delegates.
By all means, does anyone have any other questions about it? Charlie, anything else? Eric, anyone?
Anything else? Anything else?
No.
Good.
Okay, someone want to make a motion for endorsement? So, obviously the right thing to do here.
So I would move that we endorse the distribution of the. I'm not. I wish I had the literature in front of me here. Not quite sure how to word this.
What should we call it, Bruce, to this motion? What would be the right motion? Helpful here.
I think the board could just say they're endorsing the letter from the directors of health regarding ARPA to the county commissioners.
Eric, that's okay?
And assembly of
That
delegates.
would be fine. Yes.
Second.
Great, very good. Any other comments? Seeing there are none. All in favor of that motion, raise your hand and say aye.
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 And Charlie, which way did you vote?
Nay.
Nay. So it's a 3-1 that passed, and certainly want to endorse it. Bruce, if you need some support, please let the board know. Looks like there's a lot of money on the table there.
Thank you.
Okay, we're down to number 6. This is discussion on the coronavirus, and we have a list of a few things here: statistics, vaccination rate, positivity rate, and mask mandate. Director Murphy, I know you spent a lot of time preparing this, so we all can be looking, the public can look at statistics, graphs, and so on. So you're on.
Thank you, Mr. Chairman and Board. Since the last presentation, we have updated the way we're making our presentation by working with the Assistant Town Administrator, Bill Scott. He put it into a PowerPoint presentation for us, made the format that we could just work with. We worked with him, but he basically built the PowerPoint for us. So I want to give him a lot of credit. This is our first kickoff using it, and we've been getting a few wrinkles out of it, and we'll use it again tomorrow night. But hopefully this will fill up the whole screen, and people at home can see it on their channel 18. They may have to adjust if they're, it's probably hard to see on your phone, but you should be able to see it on a tablet and if it's filling up the whole screen. So I'm just going to check now. I just want to double check now with IT. Is that what we're seeing on the whole screen right now?
Yes.
So it fills up the whole screen?
Yes, it's
Yes.
great.
Okay,
Yes.
very good.
Yep.
So, so we have about 12, 15 slides. We'll spend a little time discussing what the statistics are. Then we'll end with discussion on the statistics before we move into the mask mandate. That will be last on the presentation. So with that, we have our presentation today. Okay. This just a notes on the document that information changes during the week. And this is the most recent presentation, and we do have, if the presentation has statistics from a couple days ago, we'll note that at the bottom of the page of the chart. You'll notice the bottom right-hand corner has a be safe, get vaccinated. We did carry through. Okay. As of today, we have 113 active cases. That's as of today. Since the beginning, March 11, 2020, there has been 3,368 cases. But really, we're covering what we have just today, January 24. These cases are from Sunday. We've taken and put them on the slide. What we have is the number of active cases are down. What we've found the last 3 days, and we'll be getting into that, they've gone down from the numbers of in the 40s and 50s and 60s per day coming in. Over the weekend, they went down to first time that we've seen single digit cases. And that's from two things. Sometimes what we see is not all the cases come in reported in from either Cape Cod Hospital or some of the positive sites. So we might get a big number of cases over the next 2 days. As of today, we had 62 cases, new cases come in. So, you know, it's hard to say if we're on a real decline right now because of delay of cases coming in. But they are not coming in as high as they had in the past. So whether we've just kind of leveled off, we'll notice that over the next few days. Okay. Here's the chart that we put together. And you can see from the first wave where we had about when it first started in, you know, March of 2020, we were only hitting, you know, active cases per day. It didn't really even hit 40 active cases per day. And then we notice as the chart progresses, in the end of 2020. We see it go up, and during the summer, it was when everybody was outside, it really subsided, and then it back into December, January, we hit the second wave, and you can see we kind of peaked out there at 174 active cases in one day coming into us. And that's when vaccinations began. We saw right around January, I think that's probably into December, January, vaccinations began last year. And then we saw that go down. Then we had another little spike as people were still getting vaccinated, the third wave. Then that dropped right down going into the summer. And I think we all felt pretty good going out in the summer that people are outside, things would be doing well. And then towards late July, August, we started to see the new Delta variant, the fourth wave, come in. And then you could see it spiking right up. And then Omicron came in, December-ish. So you can see where we're in right now, the fifth wave, and you can see that we went up to 272 cases one day, and that was on January 8th, which was the highest total that we've ever had for cases and active cases staying with us. As I mentioned, it has dropped down the last several days, and we're down to 113 active cases. That's the number of cases that are in the community that we're aware of, and that does not include any home test kits. These are just cases that are reported to us from Cape Cod Hospital, anybody that's doing testing for Four Cs College, anybody that's doing testing at the pharmacies will come in and we get a report through the state. So we have the daily cases coming in, and this is the overall active operating cases that we see. So we can see that it's dropped considerably over the last week, but we're not sure if that's going to spike up again. Like I said, with 62 cases coming in today, that will add to the overall active cases. So we'll have to see how that goes over the next week, whether that's leveling off or not. So I think you can, see when we always thought it was how important the different waves are, and all of a sudden, some of the cases are doubling. Okay. Our positivity rate that came out last week is compiled by Department of Public Health. Again, listed Yarmouth with a higher positivity rate than the week before, along with many of the other towns. And Yarmouth was still had increased to 22.9, almost 23%. Dennis is the highest positivity on the Cape at 23, and then Barnstable's right behind us at 22.8. So we can see the towns went higher from the 2 weeks period from before, and that was including the days when we received 79, 60, cases per day. And on the right-hand side, the new one we added was the World Health Organization in May of 2020 noted a positivity rate less than 5% is an indicator that a pandemic is under control. So obviously we have a way to go. As from the chart, when you looked at the chart, probably 2 months ago when we had a positivity rate of 8, 9, 10%, we thought we were going in the right direction before it took back off and is spreading a lot quicker with this Omicron variant. You can see at the very bottom what the county and state positivity rate is. They're both pretty much at 20%. So you can see several towns, at least 1, 2, 3, 4 towns on the Cape are higher than the state positivity rate, those being Dennis, Yarmouth, Barnstable, and Mashpee. And Sandwich is at 19 high. Okay. Hospitalizations, you can see the date on the far left-hand side. And at Cape Cod, the number of beds at Cape Cod Hospital, you can see that first column, they've increased. January last week, they're at 48, gone up from 45 to 39. So you can see those been increasing. I know it's spiked up a few days at various times. Okay. Vaccinations rates we're looking at just at these slides at tonight is just the overall vaccination rate of the town. Did not break it out by various age groups right now. We're looking at just the overall vaccination rate. And we've moved up to 77%.
What's going on with Provincetown there?
Well, that's a good one. I'm glad you picked that up. We left that in there to see who was, Provincetown's vaccinating more people than they have. So I think what we're noticing that they're noticing at 128% of the population is a lot of people are in Provincetown saying that's their residence. And in fact, it might not be their permanent residence per population registered with the town clerk. So usually what the state says is they usually just make a note of 95% or greater. They usually don't get into higher than that. But you'll notice that even though they had that high vaccination rate, if we go back a slide, and same with Wellfleet at 97, the positivity rate, if you look at Provincetown, is 12%, Wellfleet 13. So even though some of those towns have high vaccination rates, they're still having some positivity, high positivity. Okay. COVID response.
Just to point out on the last comment, being vaccinated may not be going to be changing the positivity rate necessarily.
Correct.
Right. There'll be fewer people maybe getting sick, and so fewer then getting tested. But just so people listening are aware of it, still test positively, obviously, even though you've been vaccinated.
Yes.
But those towns also seem to have the lower positivity rates to go along with the highest vaccination rates, just to point out Provincetown, Wellfleet, Truro.
Yes. Good. Next. What we do is these slides we're hoping to have updated and finalized, and we'll probably put this PowerPoint presentation up on the town website each Friday afternoon when we get all the new data up. So we don't have to wait for a Board of Health or a Selectman update, that people will be able to see what the data is, that we can update the slides, or I can say, Erica does a lot of work on it. We'll update that. So when we do update it, we'll have these links that people can just automatically go to. This first one is the Mass Department of Public Health link that shows a wealth of data on their dashboard. Did you want to do something, or want to just go to the next slide, or go ahead, either way? I mean, you've done a lot of work at it with Bill, so we can just show a typical, if you're at home, you'll be able to click on that hot link, and then you'll be able to go right over to the Department of Public Health dashboard and look into various COVID responses, where they give you updates on vaccination, testing, vaccination locations, testing locations. If you have a concern, do you have COVID? What should you do? There's a lot of information that's up there for information, but also up there on a daily basis. So we'll have hot links on these next several slides, educational slides that we'll be presenting.
But they're not on now.
Correct.
Right?
We're not live right now.
Yeah, okay.
Okay. If you The Vaccination Records, this is a new program that just came out by the state, My Vax Records. You can just, on this one, these will all be live, like I said, but if you just went to My Vax Records, Mass.gov, you'll be able to get your vaccination card printed out in case you don't have it, can't find it, or you can move it to a phone system so that you can maintain your record if needed. So this is a new program that just came out this month. I do want to say under vaccinations, we do have a clinic this Thursday at the senior center. We had a very good clinic 2 weeks ago at the center. We did almost 100 people, and we're looking at doing a second booster clinic at the seniors this Thursday. Pre-registration is required by calling the senior center. The phone number is right there, 394-7606, extension 1330. They will take your name and give you a time slot. They're booking in half-hour appointments, and this is for age 18 and above, and they have all three vaccinations boosters available: Moderna, Pfizer, and J&J, and it's open to anyone over age 18. How we got this message out, board members, is we sent it out through the seniors email list on Friday of about 3,500, 4,000 people. We sent it out on the library email list that they have, about 1,500 people. We have posted it on our town webpage on Friday under COVID page. And I have also sent it out to the Chamber of Commerce so they could send it out to their members. I have sent it out to the school so they can send it out to their staff and students to be available, age 18 and over, or their parents. And I also contacted our 5 churches in town so they could send it out to any of their membership also. So I think we got it out pretty well. And then I've also asked it to be placed on our social media this afternoon or tomorrow. So we're getting the word out there. We're hoping to be able to do another over 100. We're set up to do between 150, 160 people. So we're looking forward to that again. That's this Thursday at the senior center. Okay. County Health Department also offers vaccinations. There's several places that offer vaccinations. One's through the County Health Department on Wednesdays. Again, these will be hot links that you'll be able to get on when we post this. But you can just go to barnstable-county-health.org, and they will have information on vaccinations and testing. Again, and that's self-scheduling on that. You can just do that. They do have adults, adolescents in the morning and children later, but they are flexible because obviously you're waiting for your children to get out of school, so the parents could go at the later time also. So they're very flexible in that, and they do offer all 3 vaccinations also. Good. The community college that we've seen open up their test sites earlier in January. They're ages 5 and above, and again, they carry all 3, the Moderna, Pfizer, J&J, and they also do, if you just need a second shot, they'll do that, and they'll also do boosters. Again, you can find that one on VaxFinder Mass.gov to make that appointment. They do also take walk-ins, but it's best to take an appointment. Again, you can go to VaxFinderMass.gov, and this will be posted on our town site at the end of the week, and that will be a live link also. And they're operating on Tuesday, Thursdays, and Sundays, so that makes it at various times, so availability for people to go to the vaccination clinics. Good. We also have local businesses that are doing very well with the vaccinations, the CVS, Walgreens, and we have Stop and Shop on Long Pond that's also offering vaccinations, and you can just go to their websites for vaccination scheduling. Sometimes I know they've been taking walk-ins, but it's probably best to check for scheduling first. Thank you. Cape Cod Melody Tent was a new one that came for testing as part of the state testing program that opened up in January, and they're doing 3 days a week testing. And that's through Cape Cod Healthcare, the test site. For that, you can go to capecodhealthcare.org and they'll work your way through, or you go right through Cape Cod Melody Tent testing, and that will come up. And you can make that appointment, but that is pretty much a drive-through clinic, so you can just drive right down there and go right through. So you do not necessarily have to make an appointment. They will take drive-throughs. Thank you. Testing continues at Cape Cod Hospital. That is by appointment. They're pretty, very busy. It's close by, and easy to do. They're really geared up. And you go to Cape Cod Healthcare or capecodhealth.org, and you can get to their website for an appointment. Their appointments have been very reasonable to get within 1 or 2 days. Good. Testing. You just probably saw it come out in the news the last several days about the United States Postal Service offering free test kits, 4 test kits to 1 family address. And you can register online for that at special.usps.com, test kits. And then when you sign up for it, they're saying they should be in by the end of January. So as test kits become more available, this is a great opportunity to pick up at least 4 free test kits for your household.
There's now a phone line too. I don't know what it is, but there is a toll-free line you can call. You don't
Okay.
have computers access.
Okay, so we'll make a note of that, and we'll update this one for tomorrow's presentation. Okay. The town has purchased some take-home test kits through Mary Wagon, the community development block grant that the town had some money from COVID relief. And we've already completed phase 1 of the distribution complete, where she ordered 500 test kits distributed to 223 households. And they were distributed at the senior center and at town hall to low and moderate income families. So that was phase 1. We now look at phase 2, that additional probably 2,000 test kits or 1,000 test kits were ordered, and we're hoping for distribution sometimes next month. Again, through the COVID Relief Act, overseen by the town. And as soon as that becomes available and we know delivery date, we'll be getting that message out to the town also. We've also ordered test kits in partnership with the county health department. So we're hoping to get those test kits in possibly also mid-February, and we'll get that information out. That will be open to the public. We'll be looking at the low and income, and then people in medical need, and then we'll be just general response to the public. And you can see test kits are now also becoming available in some of the pharmacies with reimbursement for payment can be submitted to insurance companies. Okay. Mask advisory, Board of Health did a mask advisory on I want to say August 16th of 21. They did Board of Health did a mask advisory to be worn indoors of public buildings. Again, that was in August. Good. The Board of Health then in November issued a mask mandate to be worn indoors of town buildings within meetings. That was done in November. Then in December, the board reviewed their mask advisory and again mentioned to the public there was an advisory to be worn indoors within all public buildings or public areas. Just not public buildings, but public areas. Okay. Just some items that were in the news over the last several months. We can see in November, when the state reported we only had 39 COVID cases on the Cape. And we can see how that increased over the next, couple months. We go down to November 29th, 200 cases reported on the Cape. And then that leads us into December, that the hospital beds are filling to capacity with COVID cases. We go to the 18th, positivity rate continued as to rise. And then we look at December 30th with 1,800 new cases in the past 2 weeks on the Cape. So we can see the increase in cases, the effect on the hospital, and the increase in cases throughout the Cape, which brings us into December where we had seen 1,800 cases now in January. We look at the 6th, the cases are skyrocketing, January 13th, record high COVID, and then we go down to January 15th. Now we have 4,500 cases. We jumped up from 1,800 to 4,500 COVID cases within 2 weeks. So we can really see the cases increasing until today's news update of deaths still on the rise across the Cape. So you can see the increase that pretty much goes with the graph that cases have been very seriously coming across the Cape and positivity rates. So I think our next slide kind of ends the presentation, Mr. Chairman and board members, that we can see the rise that we talked about and the number of cases in the last 3 months that we got up there to the Omicron, the 5th wave of 272, and whether it's coming down a little bit. So that's the overall statistics for Yarmouth right now. And I do have to say, Mr. Chairman, I should have probably said first that we need to be out of this room by 7:05. We have about a half hour.
I appreciate you mentioning that. Okay, Bruce, that was great. And just really thank everyone who helped out with this. It's really easy to follow online. That's great. I guess, why don't we go to public comment again? If people want to come forward and address the board with any COVID-related issues, now would be a great time.
I do have the draft, the mask mandate draft, if we want to get right into that, Chairman, to put up so people can look at it at home, or they can discuss statistics.
Well, certainly, certainly at some point that the mandate that we're going to look at should be up on the screen for sure. But I just really like to hear from people. It looks like we're under some time pressure. So if the mandate can go up, what we're looking at, that'd be helpful to we have from the public.
Yes, we do have Matt Pitter that was with us before, wishes to speak, and we can let him in.
Thank you, Bruce. Can everybody hear me?
Yes, welcome.
Great. Thanks for your time, and thank you to the board for giving us a few moments. Is Matt Pitta. I'm the Director of Communication with the Davenport Companies here in Yarmouth. As you may know, we are the town's largest private employer with businesses ranging from commercial and residential real estate construction, commercial and residential rentals, fencing, senior living, and other related business lines. I'd like to take a moment to just speak about our concerns regarding the draft regulation that we were made aware of this afternoon, and that is before your board tonight, that would reinstitute the mandate portion of the mask mandate across basically all businesses and commercial lines. Now, we clearly understand the need to keep people safe from COVID, but we also strongly believe that taking this action at this time is not going to have an impact on the COVID numbers, which, as you'll see, and as I go through some of these numbers, are in rapid decline across Massachusetts. And one of my jobs here at the Davenport Companies is to report on these each day. So the increase in cases that was driven by the Omicron variant is already in retreat. Now, we look at the state numbers every day. According to the latest numbers that are out today from the Massachusetts Department of Public Health, the statewide average positivity rate peaked on January 5th and has now declined over 53%. As of this afternoon, the statewide average positive test rate is 11%, down from its peak of 23%. So again, 23% on January 5th to 11% today from the State Department of Public Health. Also, according to the state from today, the number of cases that were reported are now down 65% from that peak number. On January 8th, the State Department of Health reported 23,122 cases for the state of Massachusetts. Today, they're reporting 8,294, decline of over 65%. We've also learned in recent days from reporting from the MWRA in Boston and then earlier today from Nantucket that the amount of COVID being detected in wastewater is declining precipitously. As was reported on NPR on January 12th, there was, quote, in the headline, unambiguously good news with a sharp decline in COVID detection. As reported in the Cape Cod Times on January 20th, that trend in Boston in COVID-19 numbers was then being seen in the Cape. The viral RNA load out on Nantucket, as was reported today, has dropped by more than 1 million viral RNAs per liter in sewage. As the town discussed a few moments ago, your number of positive cases as of today or Sunday was 8. You had 113 active cases. Back on the 9th, you had 29 positive cases and 240 active cases. We would like to point out, respectively, that the numbers that were put up on your PowerPoint earlier this evening, as you'll note on the bottom, were actually from the 15th of January. Just about 10 days now. So we've seen tremendous improvement in those numbers over the last almost 10 days. I would also like to point out a discrepancy in the reporting. The Cape Cod Times story today is actually incorrect. If you look at the state data from the state website, you'll notice that as of 1/20/2022, there were 16 deaths on Cape Cod during the past 2 weeks, and that is compared to 21 deaths in the previous 2 weeks. So the reporting in the Cape Cod Times today was incorrect. If you look at the state data from the state website, the number of deaths in Barnstable County are actually down over that period. That is directly from the state. So basically at this point in the ongoing response to COVID-19, we strongly believe that there's not an emergency situation that exists that warrants the implementation of this mandate. It's evidenced and documented by these numbers, which we've just gone over. The numbers are in precipitous decline. We strongly believe that any of these decisions at this point really need to be a matter of decision for local businesses. All of our local businesses are struggling. We really should not be engaging in anything that's going to send people to Dennis or Barnstable, with due respect to our friends in Dennis and Barnstable. We do again believe at this point that these are decisions that should be made by the local establishments and individuals. And again, the numbers really tell the story. I think the two telling numbers and my final comment is that you look at the positivity rate, which has gone from 23% to 11%, and then the number of cases have been declined now by over 65% since the 8th of January. So we hope that those numbers will help in your deliberations. We do believe it shows a vastly improving condition, and it definitely does not require the need for an emergency situation to move from the mask advisory into the mandate.
Okay, thank you. Appreciate your comments and the research you've done. Anyone want to address this gentleman, or we just listen and perhaps the next person come forward before we?
I'll take any questions if you have any questions.
We probably have about 6 more people that wish to talk, Mr. Chairman.
Okay, so let's not go to questions. Let's go to people, and we'll just try to move people along. So
Okay,
get a chance to speak, and the board gets a chance to obviously discuss the topic. Okay, next, who's up?
who's the next person in, Ben? Okay,
We only have 20 minutes left, so each have about 2 minutes apiece. Let's go.
who's letting the person in? Go ahead. You need to be, well, what's the person's name you're asking to accept? Ally Johnson.
Okay,
Sally Johnson.
6:42 right now, 6:42.
Oh,
Someone there? 6:42.
yes, go ahead. You need to unmute yourself. Okay, we can see you.
Okay. My name is Sally Johnson. I live in West Yarmouth on Meadowbrook. And my concern with the mask mandate is, what about the individuals that have either mental health or medical issues that they cannot wear a mask? So if the mask mandate does pass, what does it do for those individuals who cannot wear a mask and then cannot go into a business? I find that the whole gamut of, even with as much data as we have and what Matt Pitta reported, it doesn't seem right that there's just not enough information, I think, for the town to make that decision when you have individuals that honestly cannot wear a mask. I mean, I'm not one of them, but I know many who cannot. And what does that do for them? Does that mean if they're not masked, they can't go into any establishment in this town? I mean, that's ridiculous.
Mm-hmm.
Okay, all right. Appreciate your speaking up. Let's go to the next person. And then the board can address all the comments. Okay, but thank you for speaking up. Next person, please. Looks like we've got 15 minutes left. So the next person, just introduce themselves, please. You have 2 minutes. I'm sorry, that's all we can give you.
Oh, Jerry Manning, just make yourself, there you go.
Good evening.
Yes, we can hear you.
Okay, good evening. I appreciate the opportunity to express my opinion on the mask issue. My name is Jerry Manning, Yarmouth resident, a business owner, Captain Parker's Pub and Restaurant in West Yarmouth for over 40 years. Great. I'm here to voice my opinion against a mask mandate. Number one, are masks really effective in the restaurant setting? People come in with a mask, and as soon as they sit down and reach for their water, off come the masks, and that's it for the duration. Number two, is a burden on the employees to enforce the mask mandate. It can become confrontational. You see it on the airlines daily. Policing is problematic. Also, Yarmouth businesses will lose customers to neighboring towns. People come to Yarmouth to escape Boston's heavy-handed COVID policies. Heavy-handed policies may force us to close. The winter months are a losing proposition as it is. Let the people make their own decision about masks. Advisories are fine. Mandates, no, they don't work. Thank you very much. Appreciate the healthy relationship Captain Parker's has with the Board of Health and the Health Department in general. Thank you very much.
Thank you for coming forward. Okay, who's next? It's 6:46. Someone else? 2 minutes?
Sullivan.
All right, can you hear me now?
Yes, we can.
Yes.
Okay, I'll make it quick. I'm against mandates. I think I will read what Mr. Manning just said and what Mr. Pitter just said. It will hurt the businesses in this town. Okay, they are limited on the season. Two, what Mr. Pitter said has been on the TV tonight, statewide, about the decline in the amount of vaccine on the cases. There is no emergency and it's on the decline. Okay, the federal courts, and this is something that has to be brought up. Supreme Court already ruled against OSHA on businesses of 100 people or more, and a federal court over the weekend shut down the president's mandates on all federal employees. In Boston, they're having a problem now with the mayor's a mask mandate and vaccine cards, where the police have no authority to enforce a mandate. The legislature has not made any laws that gives the Board of Health authority to put in mandates where they can be enforced by law. So I think this would be basically illegal if you put a mandate in. People want to wear masks, fine. I have no problem with that. But mandating it, demanding it, no. Thank you.
Okay, thank you. Anyone else?
Yes, we have Chris Kennedy in on the main.
Okay. (6:48). Please speak up.
Unmute yourself, Chris.
All right, thanks, guys. Let me, for getting in here for a couple of minutes. It's just, we own a small 6-bedroom bed and breakfast in Yarmouthport. Like many of us in Yarmouthport, one of the things we've noticed in the mandate, there's no carve out for size of your business. It's kind of a one size fits all that doesn't really work for the type of business that we have, especially this time of year. And the other point I'll make is that a mandate at this point seems to be about 2 weeks too late when it comes to Omicron, as pointed out by the Davenport Industries representative earlier. We are seeing the downside of Omicron. We are seeing that it's going to be here either way. The mandate is not necessarily going to make any difference in the transmission of that disease, especially in small businesses like ours. Please rethink that part of the mandate. It should still be a recommended action. I agree with that 100%. Even here at the inn, we will have people wear masks if they can't socially distance. I also note that in the verbiage in the mandate, there is no reference to if you can socially distance 6 to 10 feet, that the masks are not required. There is no cutout for that, especially in these small locations. I respect that. The other thing, I will make one comment that as a Board of Health, if you are looking to vote on a mandate, and if there's a mandate in place for town buildings as they sit, there is a member of your board sitting on the dais that is not wearing a mask. It doesn't do much for your public perception in what you're trying to do. And thank you.
Okay, thank you. Appreciate that.
Two more speakers, Tom Nicanello next.
6:50, 2 minutes. Thank you. Tom?
Yeah, yes, good evening. It just takes a hair of a second to get the communications working. So now that you can all hear me, thank you very much for your time as a volunteer on the board. The director putting in all his time. This is a lot of work. And from what we see tonight in your previous agenda, we had some violations due to the fact that, you know, our health department is completely understaffed. And we don't really need some of these outside inspectors coming in if we could just fund the health department a little bit more. So with that, I kind of hope you get that HARPA money, and because we could really use probably 2 full-time more bodies in the health department. And as it shows tonight, Mr. Scott did a wonderful job in his presentation. It's because of the fact that we don't have enough help in the health department to make presentations like that. And Mr. Scott, if you're listening, a pie chart in those forms would be wonderful to look at. So what I also saw tonight, and I'd like to note, is that you have a 77% vaccine rate, which you want it to be 80. Well, you're pretty close. And I think the the 24,000 residents and the 18,000 residents that you have vaccinated, you have done a remarkable job educating the public. As it shows by your numbers, you have a 272 uptick in probably October, November, right? So we came out with a mask advisory, which was available on the website, but we didn't have no enforcement to go around to make sure that the public buildings were posting the mask advisory sign. We have no enforcement because our health department is underfunded and it needs help with some people who can actually do the work and make it easier for other people to enforce the work. So what I see is the education that has been happening through the director's wonderful response of putting signs out, going to organizations, Rotary and everybody else in educating. And it shows that the numbers have come down. You're 272 to 113 up till January 5th. The evidence is there that education before regulation is the way to go. Thank you. Have a good night.
Okay, thank you for speaking up. Anyone else? It's
We
6:52.
have Mary Vilboin, the Director of the Chamber of Commerce.
Absolutely.
That will be our last speaker that we have noted.
Mary, good evening. Mary?
Good evening. Thank you, Mr. Chairman and committee members. I just wanted to, I don't want to repeat what others have already said this evening, but I did want you to know that our office received an email this afternoon at approximately 2:20 p.m. notifying us in writing of the proposed mask mandate. We feel this was not ample time for us to notify our members, but we were able to get information out by 3 p.m. and I'm glad to see that so many of our business owners have chimed in tonight and expressed their opinion on this matter. The Yarmouth Chamber of Commerce is expressing our serious concern of imposing a mask mandate at this time. We feel this could be detrimental to our businesses that have been hit hard by this pandemic and continue to be hit hard. We feel, and especially through the data that Mr. Pitta has shared with you this evening, we feel that this statewide trend of the decrease in cases does not warrant an emergency mandate. We would ask you not to impose a mask mandate and allow our individuals to make this personal decision. We thank you very much for allowing us to speak tonight and hope you will hear us loud and clear.
Thank you. Thank you, Mary. Okay, it's 6:54. Bruce, you said we need to be out by 7:05. Is that what you had said?
Yes. You have 10 minutes.
Yeah, that's unfortunate. Okay. Board members, how do you want to handle this? We have only 10 minutes here at this point, so it looks like time-wise. So, board members, what would you like to do?
I'm willing to speak out on this issue. I think that the time has passed for a mask mandate. I have been in on some meetings now, other than the Board of Health, and the mask mandate for public buildings is not being honored. People aren't following it. People are going to do what they want to do in terms of the masks. I think that I would rather look at what places like Boston and Brookline now have done in terms of mitigation efforts. I think we're not preventing anymore, but we're trying to mitigate. The statistics that Bruce showed let us know that Cape Cod Hospital had 48 cases of COVID and I forget 5 or so in the ICU. We follow Cape statistics because the Cape is not always following the state. So we're looking at it locally in terms of our population, the ones that we are tasked with protecting. So I think that the time has passed for a mask mandate. I think it would just, as the businesses said, you know, they're very nervous about it. A lot of them are very tenuous right now. This is not a good time for businesses, period, on the Cape from the seasonal standpoint and also from the COVID standpoint. I just think that it would cause more acrimony than it would, and obviously we do not have the staff to enforce this. We do have the authority, by the way. I will speak to the speaker that thought we did not. We do have the authority to do this, but we don't have the enforcement capability. And I don't think it's fair to put that on the staffs of the businesses to enforce. That's my thought about it. So again, as unpopular as it is, I would look at something like a vaccination mandate, because we at 76%, that's not wonderful. Right now, we need to get as many people vaccinated as possible.
Okay, Mary, thank you. Yeah, troubling. And I agree with you. The 76%, whatever, it's, as we know, it's the vaccination looks like it's requiring boosters. So it's going to continue. It's not like it's over. People are saying the numbers are going down. We were looking at 5%. This is far from over. There's a subvariant of Omicron that got picked up in Denmark they're concerned about. So this is going to continue. So it's not an acute emergency. It's becoming a chronic one here in town. And I agree with several people have said that obviously we cannot monitor it. We don't have a health department that has the number of employees, basically. We don't have that. So enforcement, I agree with you, Mary. That's certainly not something we want store owners to be in position. They would not be able to, nor should they. And we went through this even in beaches during the summer, as far back as then. But, it's I just struggle with hearing people speak about it. Numbers going down, everything's wonderful, it's getting better. That's not where we're at. Where people are dying, okay? People are dying. More people are getting sick overall. We have kids are getting sick now. A lot more getting hospitalized. We are a town with a very high number of individuals with comorbidities, meaning they have other health problems that put them at significant risk besides just their age. So it's just troubling. The point was made about Charlie. You're sitting there representing the Board of Health, and it's upsetting for me to look at. When someone's not wearing a mask, they're putting other people at risk. Okay, let's cut to the chase here. That's what I am struggling with. The idea that someone's not going to wear a mask, it says something. They're not really caring about other people who are at risk, and you putting them at risk. So the gentleman who mentioned that, stating that, I appreciate it. Mary, you mentioned about vaccinations, okay?
Right.
I mean, how would something like that be implemented? What were you thinking of?
Well, again, it kind of butts on the same type of problem with masking, but there would have to be someone, we would have to very, very clearly define the types of establishments that we would require vaccination for entry. It would not be everything. It would not be all public places, but it would be the specific kinds of places where there are people in close quarters. I mean, I'm just talking in general terms. And
Sure.
Then it would require the person who is letting people in checking the vaccination card. And basically the vaccination mandates in Boston and now in Brookline have been pretty lenient. I mean, they're just asking at first, with Brookline is January 22nd, for one shot, and then it goes on to February, the 2, and including then the children under 12. And then March, it goes on saying that the children should have 2. So it's not, I don't think it's onerous. I guess it's onerous to people that don't want to get vaccinated, but I'm, you know, the news from Boston is that their vaccination rate increased 36% on the weekend after the vaccination mandate went into place. So people knew that they weren't going to be able to go into their favorite restaurants and pubs or some of the venues that are open, or probably even fitness clubs, without having proof of vaccination, at least the start of it. And their vaccination rate went up. And I've read that about some European countries also. So yes, the onus would be on the owner of that establishment, or the person, you know, letting the people in, but it wouldn't be a widespread encompassing all kinds of businesses and all kinds of situations type thing. I would see it limited to the types of things like a fitness club or a gym, eating inside a restaurant, the kinds of things that we're looking at are the most liable to cause the infection to be spread.
Yeah, I've been to a number of places, they check temperature when you go in.
And that doesn't do it. Yeah, that has been proved useless. But yeah, I mean, that definitely, there were some places in Hyannis that were doing that, as well as my dentist office did that. And, you know, if it made them feel better, great. But, you know, that, and of course, who cares about that? You know, I mean, that's not, I'm guessing that people who are all for freedom would not feel like that's an invasion of their privacy to have a thermometer.
I'm going to just tell them that.
Just one comment I just thought of, there's a woman who addressed the board tonight about people who don't have the ability to put a mask on. Just to point out that in the advisory and in the draft here for possible mandate, it's really very clearly stated of who should not or cannot wear a mask. I mean,
right. There are exceptions. Absolutely. Yes.
Very clear exceptions. Okay. Eric, Charlie, we've got a minute or two left.
I'm against this. I'm against this mandate. Simple as that.
Okay, good.
Thank you, Charlie. Eric, anything?
I guess I just have to say that I would agree that time has sort of passed for it to, I mean, we can continue to follow the numbers, but no, I think it would have been most effective 3 weeks ago, 4 weeks ago. And there's a very clear stance from the public here. It's a small portion of the public, but it's a strong statement being made. So
yeah, no, I agree. The response to whether the advisory is dismal. People just making their mind up and they're doing what they want to be doing. I can't disagree with what you've said. I just think as a community, I would have hoped we would be doing a better job supporting each other. Just the residents, select board, administration, that would be working together. Not putting a mask on and breathing on other people puts other people at risk for illness. And if it's an elderly person or a person with other illnesses, whether they've been vaccinated or not, putting them at risk for hospitalization and death. So I just, once again, being redundant, it's a statement of how you feel about other people if you're not putting a mask on when you're in public indoors.
It's protecting you too.
Okay. I know we have to move on right now. We have the next meeting coming in. Do you want to just take a vote right now of whether to go forward or not?
Sure. I move that we not pass a mask mandate at this time in the town of Yarmouth.
Second to that motion?
Second.
Great. Thank you, both of you. Any other discussion? Since we have no time, there is no further discussion. So all in favor of the motion, just raise your hand and say aye. That's
Aye.
aye, that's 3. Charlie?
Yes, he has his hand up.
That's 4. So unanimous not to move forward on a mask mandate here in town. So just to finish things up, we have our next meeting, unless there's an emergency. The next meeting will be on the 7th of February. Bruce, anything else before we adjourn here?
No, that's it, Mr. Chairman.
Thank you. Thanks for all the work, Bruce. Someone make a motion to adjourn?
I move we adjourn.
Second.
Thank you. All in favor, say aye.
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 Unanimous. Thank you for board members, Bruce, and for the public coming forward.
Thank
Stay
you.
safe. Good night.
Get vaccinated. Bruce?